Welcome to Startup Greece Talks. On this episode, I will meet Evangelos Evangelou from OpenDNA. Welcome, Evangelos. My pleasure to have you here with us.
Hi, Thanos. Thanks for the nice invitation and the kind introduction.
Thanks a lot once again, and it's my pleasure to meet you once again and to talk to you about what you are doing in OpenDNA. Before we talk for OpenDNA, I would like to ask you, where are you right now?
Well, I'm based in Greece, in Ioannina, the so-called lately Silicon Valley of Greece. I'm not sure how true this is, but our vision is to make this prosperous startup community to be even bigger in the future.
So
I'm a professor of clinical molecular epidemiology at the University of Ioannina, the medical school here. I also hold a joint affiliation with Imperial College London in London, and I'm the Chief Scientific Officer of OpenDNA and co-founder.
That's great. So you see potential in the area of Epirus and Ioannina in order to create a vibrant startup ecosystem over there.
Well, I think that there is a momentum, and I think that we have a great team here, at least for what we're doing in our company, which is very specialized. So I definitely see future in this initiative.
So, and how you see? I mean, you are a professor in the university. You are running your own lab, and at the same time, you are running a company. Is there the spirit of entrepreneurship among the academic society well spread?
Well, definitely it is not. And actually, when I started, and even now, sometimes I feel totally stupid about how to grow a company and how to move things on, how to search about investors and stuff like that. The good thing is that the other co-founder, Ralph Eldai, is a clinician, is a physician, but has never practiced medicine before. He has an MBA, and actually he works with such companies from his early stages of his career. So let's say that he's leveraging things in order to from the other perspective, not the scientific one.
Okay, so before we jump in the real case, I mean the OpenDNA and what you are doing on OpenDNA, could you please share with us some more about your background? You said that you are a professor in University of Ioannina. You had studied and you have partnership with Imperial. Could you please talk further about your background, your previous experience on the field of entrepreneurship and as an academic person?
Yeah, so my background is in epidemiology and biostatistics. In the last 10-15 years, I'm working heavily with big data and genetic epidemiology. So what we're trying to do is to find out specific positions in the DNA that are associated with complex disease. When we're talking about complex disease, we mean diseases like cardiovascular diseases, cancers, neurodegenerative diseases, not monogenic diseases, but diseases that in order to be developed needs a genetic and environmental component. The last 15 years, I have led several efforts, both national and international, and we have been able to be part of large initiatives and projects that have been decipher, let's say, the genetic architecture of several complex diseases. So this is my academic background, but regarding the entrepreneurship and all other stuff, to be honest, I didn't have any background before, starting getting involved with OpenDNA about 3-4 years ago.
Okay, so how you come with the idea and how you said, I'm gonna do this as a entrepreneurial project and not an research, and not as a research. That is quite common for a professor and for an academic team.
Indeed. Well, I think, yeah, I was lucky enough to get contacted by Eran, the other co-founder. About 4 years ago, we published a major paper on hypertension and genes that are involved in the increase of blood pressure. And so back that period, I was working on developing what we call polygenic risk scores. When we're talking about genes that are associated with a disease, it does not mean that if you have a specific gene, you're going to develop blood pressure or cardiovascular disease or stroke or whatever. You know, each risk is very small. So what we were trying to do is to develop scores, you know, a single score, accumulating all the information that we had from the genetic code in order to make this more simple. So I had this idea about, you know, applying this to several complex diseases, but then I sent me an email, you know, a little bit more specific. Hi, I'm interested in this project on hypertension, and I saw your paper. I saw that you're presenting at this conference. I want to meet up, and it happened in 5 minutes. So, you know, we both liked each other. We brought our ideas together, and this was it. For about 18 months, we were trying to build the idea, you know, and to pitch the idea to investors and other people that might be interesting all over the world, to be honest. And we were able to get the pre-seed funding from the Israeli Innovation Authority. So the company is now based in Haifa. And we started just a few days before the COVID restrictions, the 1st of March of 2020.
So you made it. I mean, you managed to get everything launched, and I mean to set up the company in Israel. And could you share with us some more information about how easy it is to launch a company in another country, or it has, you know, it was your partner's decision, and it was easier due to your partnership?
No, actually, it was our decision was to go wherever we could get money in order to start. So it could be Greece or wherever. I think that most of us are familiar that the Israeli startup environment is thriving. So, you know, one of our efforts in Incubator there, along with the Israeli Innovation Authority, gave us the opportunity to start there. So it was an easy decision to start the company there. And actually, the whole process, even for me, that I'm not an Israeli citizen or whatever, it was really easy to start and launch a company there.
Okay, you started more than 2 years before. So you had an idea and you have started, you have some papers, or you had the academic background in order to support and run what you are doing. Have this changed, and how you have started and what you are doing right now?
Well, I think, we started with hypertension, to be honest. So, but down the road, we decided that we found out that we had the ability to develop, you know, our tool, but I'll be able to explain to you later what we're doing, to other complex diseases. So now we have a product, which is a software that calculates this polygenic risk scores and risk for cardiovascular diseases. Can be hypertension, stroke, myocardial infarction, cardiovascular disease, diabetes, and now we're developing this for cancers, osteoporosis, IBD, inflammatory bowel disease, and other complex diseases, as I mentioned before. So our goal is, you know, by the next 6-12 months is to cover a broad, to have a broad, you know, burden of diseases covered from our tool.
Okay, it's quite clear what you face and what you are doing, but who has this problem? Who has to care about this?
Well, actually, what we're trying to do and what we're trying to provide is precision medicine. So I mentioned before that complex diseases are interplay between environmental and genetic factors. So you can change the environmental factors. You can exercise more, or you can eat healthier. However, you cannot change your genetic code. And this is something that may increase your risk in order to develop a disease. But the thing is that the physician, the doctor, does not have this information. This is a field that is expanding the last few years. The first study that broadly assessed this kind of risks was about 15 years old, so it's kind of a new field. So that doctors are not trained in order to assess these risks, and they do not have the ability to assess this big data. So what we're doing from our side is to provide to the physician in a very simple score, let's say, that the patient that he has in front of him, her, in order to provide the treatment, has a high risk to develop a disease or a low risk to develop a disease. So this may change the way that applies his clinical practice. So it's different to have someone that is doing well and he has some healthy habits, etc., but has a very high risk to develop cardiovascular disease in 20 years, and different when you know that everything is fine. So this is mainly the first problem that we're trying to solve, to provide this type of information to physicians, that it's very difficult for them to find out what's happening, what are the genes that increase the risk for a specific disease, etc. And actually, we're working with genetics or genomics, but in the future, our vision is to include other type of these big data, as we call them, like proteomics, metabolomics, transcriptomics, all this information that's it's not handed to the physicians, but they can change the way that we can practice that we can apply the clinical practice in our office in the future.
So right now you are providing that solution to physicians, to clinics. Who is the customer right now? Or you have directly, there are some companies that are working with they are selling genomics packages and they are selling directly to the customers. So what is your the way that who's the customer, and what do you provide?
Mm-hmm. Right now. So what we're trying to do, because our goal is to have our first customers in the first quarter of 2023. Right now, we're doing some pilot studies, and we have some MTAs, very strong MTAs in the United States. So more or less, let's say one of these providers is Mayo Clinic, that has invested in our company as well. So Mayo Clinic is one of the best, one of the largest organizations, hospital organizations in the United States. So we have a pilot study there. And actually we're doing some pilot studies, and we have our initial results from practices in the Northeast, Boston, New York, Northeast United States. These are practices, private practices, that doctors have the ability to have this type of test and provide this type of information and guidance to their patients. Other potential customers in the future could be companies, unions, can provide this as an incentive, and, stuff like that.
Is there any ethical, issue that may arise through the use of data and how you manage? I think that it's the most common question about how you use data, and if data are for health reasons. I mean, to there are some issues that may arise. How you face that?
Yeah. Well, our data are totally anonymized, and the doctor gets information, as I said before, very, very simplified. So it does not get information on the genetic code of the patient, just indication that this is high risk or low risk or average risk in order to develop a disease. We do not sell and we do not share our data with insurance companies. So in terms of that, we have passed all the regulations in the States that needs to do, in order to do at least the pilot studies that we have, in order not to have ethical issues. But I totally understand your questions, but we're definitely not selling, we're not sharing data.
Great, and we have seen the rise of the medtech and whatever is with medtech and biotech after COVID. So how big is the market that you are and you are willing to be?
The market is really large. Actually, we have assessed that for hypertension alone, the market is about 1.7 billion. If you take into consideration other complex diseases like cancer, where the treatments are very expensive, and patients may get may need to go to hospital for days, etc. This gives some evidence that the market is really huge.
And I think it's gonna grow the next few years, isn't it?
Definitely, because you may be aware that people are eager to get this type of information. You might be familiar with 23andMe, My Ancestry, My Heritage, and stuff like that. So they get similar information on what we get, to be honest. And actually, our company is able to handle this data as well. Not only to have the patients to provide their test from scratch, but if they have previous data from these companies, we can handle them and provide the same information to the doctor, to another cost. So this is a market that we see that potentially will grow in the future extensively.
You said that there are some other players in the market, and they are growing, and also some of them are too many years and are listed companies. So you understand what's the potential of them. How you enter the market, and what is your unique, let's say, competitive advantage that you can make you to be the one that you really, you are ahead of the competition?
We definitely have competitors, and some of them are really strong ones. But we have a different business model. Most of the competitors are trying to sell this information to patients directly or something similar. We are distinct in two ways. First of all, as I said, the business model, we're trying to sell this to private practices, to large hospital organizations, to unions and companies. And also the other one is that we are incorporating the clinical data. So it's not only the information that you're getting from your genetic code, but other clinical data, some simple ones like if you smoke or if you have diabetes or if you have high cholesterol, when we are talking for cardiovascular risk. And then we apply a machine learning algorithm that we have developed, and we have a patent as well. So this makes us distinct from the competition right now.
Okay, and you said about that you are providing this. Is this a software as a service? Is it data as a service? Is it a platform as a service? How you provide?
It's as we have started, this is software as a service at the moment.
Okay, and right now you have some, as you said, you have some pilots. You are running some pilots with like Mayo Clinic, or maybe the most famous in the US. And so what's the plan on the next few years? I mean, how many customers you would like to have? What's the pipeline for the next months?
Well, our initial goals in 2023 to have our first customers, and we're discussions and we have some MTAs. Hopefully, we'll be able to, to have our initial customers in the next few months. So we're quite close in order to, to launch and have some revenue with our first tool, which is the Cardio Risk Plus, as we call it, which is for cardiometabolic diseases. But as I mentioned before, we're expanding this, and now we're developing this for other complex diseases.
Is there any chance for the European, if there is a chance for Europe or any other country to follow and to lead that sector? Because you are talking about the US, you are talking about this ecosystem that it seems to be more familiar with these technologies and genomics and data in the health sector. Is there any chance for Europe to follow that thing, or you believe that the market is and you are focused on that?
Actually, we have links with the UK, and actually we have a small collaboration there with a small organization that is specialized in diabetes, as far as I remember. So definitely UK can be a target in Europe at the moment. And of course, Israel as well can be a market. It is not a large one, but now we have started with an incubator in Israel. Actually, they were invented the first money, the pre-seed funding in our company, and one of the investors in this incubator is a large hospital in Israel. So we have access in some data there, and we're talking with them with collaborations. So our initial goal is to expand in the US, but definitely UK is a target.
I see. And what about, you said about the incubator and the investors that you already have? So what's the pipeline on fundraising, and at the same time, you were bootstrapped before, or you just got the money from incubator and things, you speed up the whole process and the whole structure after you get the money?
Well, the incubator and the Israeli Innovation Authority were able to get the pre-seed funding from them, which was pretty good in order to start. And maybe it would be useful to say that the investors in this incubator is IBM, Medtronic, which is a very biotech company, Pitango, which is a large VC in Israel, and Ramab Hospital, the hospital organization that I mentioned before. So the investors are, let's say, pretty big players in the field. And we're able to have about 1.5 million in the next 18 months, the last 2 years. And our goal now is in the first quarter of Q3 to have a seed funding of 3.5 million. So this is our plan in order to grow in the next few years.
So you have decided to grow, and you need some people to. And as you are a professor, you have access to talent. And how is it to deal with students, with postgraduate students or researchers? And are you still believe that Ioannina is the best place to be established, or you are thinking in order to move in the US and also in Israel? How you see the growth of the team? And
Well, in the field that we're working and we're developing our product, we need specialized people to work with people with knowledge and expertise on big data and other omics data, and this is not easy. We're quite happy because our lab here in Ioannina has developed this expertise, and I may say that we are the only lab in Greece that has so extensive experience on that. So, in our initial steps, we have postdocs, previous postdocs of mine that are working for the company, and we are doing the part of the R&D for the company. But definitely in the future, we should be able to attract people from all over the world. But definitely, I think that for the initial stages, we have the capacity and the knowledge to build something here in Ioannina.
Please share with us some more about the team. You told us about your partner. Are there any other members, and how big is the team?
Yeah, definitely. So, as I said, Ranfel Dai is the CEO of the company and co-founder. He has an MBA. He's a physician, but he has an MBA, and he has worked extensively before with startups. He has successful exits in the future. He's very experienced on that. Erez as well is a full stack engineer, and he had about 25 years of software development and development of algorithms. Also now we have Max, which is an angel investor and CEO of a company that we're closely working in the United States, gene by gene. We have an agreement with them to provide us the tests and do the testing in their labs. And also NIR, that is based in the United States, that is helping us with the business development. And also a couple of previous students of mine, Yorgos, that has been specialized in genetic epidemiology, and he's doing the hard work on assessing all the data, analyzing the data in order to develop these tools. We have an extensive advisory board from the States, from the United Kingdom, people specialized in different broad burden of diseases. And I think that we have a very strong team, both in the business perspective and the scientific perspective.
It seems to be, like you said, you have a very good team, and this is quite important, especially when you are on the first steps. Let's take it and discuss about the exit. Is there any exit strategy? Because we are right now on the early steps, but do you have an exit strategy? How big you believe that OpenDNA gonna be?
Well, we do have an exit strategy. I cannot share with you more information right now, but as I say to my wife, it's going to be very big.
That's a very nice answer.
She does not believe in me yet, but I think it's going to be big.
Okay, that's very great, and that's very cool at the same time. So, and quite important to hear that you have you have something on your mind, and you believe on that, and you strongly believe on that. So for sure, the impact is quite important as we are talking for the industry that you are. So could you tell us what's the vision of OpenDNA? What you would like to do at the end?
Yeah, to put it very simply, is to change how clinical practice is applied. Mm-hmm. We have the vision in 10 years that you will jump in a doctor's private office, and it's going to be totally different from the experience that you have right now. Maybe not yet in Greece, but the States at least. And I'm saying this because our vision is not to share on the genetic data that we have talked about, and these are the tools that we have developed. We have the vision of sharing with the doctor and simplify all this big data that we have now in our hands in research. And it's very difficult to interpret, very difficult to assess. Sometimes it's very complex for us as well. We need to do a lot of steps in order to understand how our body works. But bringing together all this big data and combining with artificial intelligence, I think that is the key element in order to give us the opportunity to succeed in our vision to change how clinical practice is applied.
That's a great vision. So I think with that, to change, as you said, to change the way that the experience actually for the patient perspective, and at the same time, this whole process to be changed and transformed to another way, it's something quite huge. And with that, I would like to thank you and to wish you best luck. And I'm really excited to have you here and to talk in 10 years from now and discuss on how you have done and what's the impact and what's about the next challenge and the next goal. So thanks a lot once again, and
Thank you.